Hello everyone, welcome to this channel. From today I'm going to talk about our last system of our body, which is hepatobiliary system. This system includes our liver, hepatic duct with gallbladder and bile ducts. Okay, so first of all we're going to talk about our liver. Okay, liver is also known as hepatic or hepato. Anyway, so this is the second largest organ in our body. It is reddish brown in color, soft in consistency, very friable, and present in the right hypochondrium along with the epigastrium and extended little bit up to left hypochondrium. Okay, so it is the second largest organ in our body. Now in male, the weight of the liver is almost 1.5 to 1.7 kilogram. Okay, and in female it is almost 1.4 to 1.6 kilogram. Okay, now this liver is also known as the largest gland in our body, which secretes bile and other metabolic products. As you can see in this photo, this liver has anterior surface, posterior surface, superior surface, inferior surface, and right lateral surface. Okay, now in between anterior surface and inferior surface, you can see the sharp edge like border, which is inferior border, extended up to the right lateral part to the left part. Okay, and other borders are ill-defined, rounded. Okay, so if anyone asks in your exam that how many borders has liver, you're gonna say only one, which is inferior border. That's it. This liver is attached with three ligaments: posteriorly with our ligamentum venosum or venous ligament. Okay, inferiorly with our ligamentum teres or teres ligament. Okay, and anterosuperiorly with our falciform ligament or ligamentum falciformis. Okay, now you have to understand one basic thing, that as I told in my earlier videos, that imagine this is my central axis and this is my liver. Okay, now what happens, as you can see in this photo, this falciform ligament presents just a little bit lateral. Okay, it's little bit lateral or few centimeter away from the central axis. So at the perspective of central axis of the body, falciform ligament is in lateral position in the left side. Okay, now understand one thing, we divide our liver into two parts or two lobes, right lobe and left lobe, at the perspective of falciform ligament. Okay, this side of this falciform ligament is known as right lobe, and this side of this falciform ligament is known as left lobe. Okay, so the right lobe is almost 5/6 part and 1/6 part is left lobe. Along with this right lobe and left lobe, you are getting caudate lobe and quadric lobe. These are extra. Okay, in this photo you are viewing the liver in the posterior view. Okay, posteriorly what you are seeing in the liver in this photo as this caudate lobe is the part of the posterior surface of the liver. Okay, now it is bounded by the right side inferior vena cava, left side ligamentum venosum, and inferiorly you are getting porta hepatis. Okay, now the upper part of the caudate lobe is continued or the continuous or mixed or aligned with the superior surface of the right lobe of the liver, and the lower part of the caudate lobe is aligned or mixed or continued via the caudate process and to the inferior surface of the liver. Okay, I mean the right part, right lobe of the liver. Okay, along with the inferior surface of the liver, you are getting another lobe, which is quadric lobe. As the name suggests, it is quadrate, so it is obviously rectangular. It has four corners. Okay, now it is anteriorly bounded by the inferior border of the liver. Posteriorly it is bounded by the porta hepatis. In the right side it is bounded by the fossa of the gallbladder, and in the left side it is bounded by the ligamentum teres or teres ligament. Okay, now as I am saying, this is a porta hepatis. What is porta hepatis? Basically it is a 5 centimeter narrow fissure type, or it is a entry point or exit point, just like hilum. You can say it is hepatic hilum, or it is basically medically known as porta hepatis. Now it is presented or it is present in between our caudate lobe and quadric lobe. Okay. Now, portal veins, hepatic artery, and few hepatic nerve plexus gets inside of this porta hepatis, and right hepatic duct and left hepatic duct gets outside of the porta hepatis. Okay, so it is an entry or exit point, just like hilum. Okay, now in relations of the liver, you are getting mainly two segments. One is in the perspective of the peritoneum and in the perspective of the viscera. Okay, in peritoneal relationship, you are getting in the posterior surface of the liver, you are getting a triangular open area or a bare area of liver. Okay, bare means open. Anyway, so this area, it is surrounded by the two layers of the, superior and inferior layers of the coronary ligament. Posteriorly, you are getting another part or groove area or a sulcus just for our inferior vena cava. Okay, and in visceral relation of the liver, mainly our anterior surface is related with our xiphoid process. Okay, then little part of the diaphragm in superior surface and the anterior surface, it is also related with our falciform ligament. Okay, now in the right lateral surface of the liver, it is covered by the diaphragm and has sometime in some people you are getting impressions of the 8th, 9th, 10th ribs. Okay, in posterior surface you are getting impression of suprarenal gland, then inferior vena cava, then diaphragm, then right inferior phrenic artery, then celiac trunk, ligamentum venosum, and esophageal opening. Okay, inferior surface of the liver is related with the ligamentum teres, then gallbladder, first part of duodenum, transverse colon, lesser omentum, and right hepatic flexure. The superior surface of the liver, little bit left side, you are getting, or it is related to the pericardium. In blood supply, we are getting two segments as usual: arterial supply, venous drainage. In arterial supply, this liver is getting nourished and oxygenated via hepatic artery and portal vein. Now, this hepatic artery and portal vein stays together always, and when it goes or it enters into the liver, it divides into right segment, left segment. Now, these segmental vessels again subdivided into interlobular branches. These interlobular branches again divided into end arteries or end vessels or the end terminal vessels. Okay, now these terminal vessels enters into the hepatic sinusoids. Okay, I will talk about these things, hepatic sinusoid, in special videos, not now. Coming to the venous drainage, this sinusoids creates interlobular vein. This interlobular vein creates subsegmental veins. These subsegmental veins merges together and creates hepatic veins. Now, this hepatic vein ultimately drains into inferior vena cava. Okay, and in the nerve supply, you are getting sympathetic and parasympathetic part. Sympathetic part is coming from hepatic plexus, and parasympathetic part is coming from vagus nerve. That's it. Now, the function of our liver. In the function, you are getting, first of all, it controls our metabolism. It controls fat, protein, carbohydrate metabolism. It synthesizes or creates bile along with prothrombin, along with vitamin K. Now, it stores glycogen, fat, vitamin A, vitamin D, iron. Okay, it participates in immunity factor. When we eat medicine, it metabolizes the medicine also. And the last part is microanatomy of the liver. The microanatomy of the liver is very, very special part, which I will talk about in special chapter, not here. So this is all about our liver anatomy. I hope you a little bit understood. See you soon with the next topic. Till then, bye.